Hello, I'm Dr. Sam, this is Dr. Sam's Health, and today we'll talk about COVID-19 again. Specifically, I would like to talk about the statistics. I think I've mentioned in a couple of videos of mine that I've got a strong background in statistics and epidemiology. I'm not a proper statistician or an epidemiologist, I'm a medical doctor, but at the same time I've done my PhD and I have published some research that is epidemiological in nature. So I'm very good with numbers, I'm fascinated by them, I'm actually a numbers nerd, I'm a numbers guy for sure. And ironically, this skill set comes very handy in the midst of pandemic. So today I would like to dissect the statistics that we hear on a daily basis and to put them in some context and to help you navigate them. But prior to doing so, I need to make a couple of disclaimers. First of all, I'm a practicing physician and I don't want this video to be considered to be a medical advice. It is not a medical advice, it's an educational video. I'm just trying to explain things the way I understand them. And if you seek medical advice, please go to your family doctor, to a walk-in clinic. If you're an emergency, call 911 or go to the nearest emergency department. Again, this video is for purely educational purposes. It contains my educated opinion, but it's still my opinion and it's not a medical advice. And the second disclaimer is related to the content of this video. I don't want you to take it wrong. I'm going to talk about some statistical misconceptions or misrepresentation of the data, and I don't want you to feel that I'm trying to minimize the seriousness of the problem or to instill some fear or panic. Actually, the whole point of this video is to make sure that everybody understands the numbers properly, nobody is panicking, and at the same time we take this problem seriously. I do believe that the pandemic is a very serious issue, it has to be taken seriously, and it has to be addressed properly. So these were my two main disclaimers. I'm sorry for such a long introduction, but I felt that I have to do these things because I'm a medical doctor and I belong to professional bodies and I have to be professional and I don't want anything that I say to be misinterpreted or taken in a very wrong way. So now we can talk about the statistics. And my first thought or observation is that the numbers I see in the news are the scariest ones possible. I'll give you an example. Say, if I told you that there is a certain condition that affects 0.03% of the world population, would you be worried? I don't think so. But if I told you that in absolute numbers, 2.5 million people worldwide are infected with certain condition, that there are almost 200,000 deaths due to this condition, and I would add some pictures of grieving families, overcrowded hospitals, overwhelmed staff, some refrigerators used as a makeshift morgues, I think you would be quite worried and tense about this, right? I hope you see where I'm going with this. And again, I don't want to minimize the problem, but I want the news outlets, anybody who is trying to inform us about this pandemic, to actually do it properly and to put the information into the proper context. And that's what I'm going to do in the next several minutes. So what I'm going to do, I'm going to talk about the three statistical misconceptions or myth, if you will, that are surrounding this pandemic and they're creating a lot of fear and tension. What I would like to start with is comparing this pandemic to the regular flu. And before you get upset and annoyed with me, I know I sound like a politician right now because a lot of politicians are comparing it to the flu. I would like to say that this comparison is actually valid in several aspects of it, and at the same time there are certain huge differences. And I think that there is a myth or misconception that it's more or less like a flu. I don't think that this pandemic is like a flu. I think it's a much more serious problem than a regular flu, but I still think that we should compare these two so that you could understand the numbers much better. So what are these numbers? If we take a look at the CDC website, we'll see the data for the 2018-2019 flu epidemic, if you will, and the stats are actually quite impressive. So there were around 35 million cases of flu in the United States. There were almost 500,000 hospitalizations due to flu, and there were approximately 34,000 deaths due to flu. So let's compare these data to the COVID-19 numbers. There were less than 1 million cases, documented cases of COVID-19. I think it's approximately 800,000 right now. There were quite a few hospitalizations. I don't have a number for that, but I know that the number of deaths is slightly higher than 40,000, which is a very tragic figure, of course, and my heart sincerely is with those whose lives were affected by this pandemic. But at the same time, you can see that the number of deaths is quite honestly comparable to the number of deaths due to regular flu. And that brings me to the first myth or misconception that I would like to dispel today, that a lot of people believe or say that this COVID-19 is not much worse than a regular flu and it's pretty much comparable to the regular flu. I don't think it's the case, and there are several reasons for this way of thinking. First of all, the US population is at least partially vaccinated against the flu. I'm not saying that this vaccine is super effective, but at least it's something. It curbs the fatality, it curbs the course of the disease, which likely runs a little bit milder than it would without vaccination. The second thing is the fact that a lot of people already had the flu, and by a lot I mean that a substantial portion of the US population had the flu and accordingly are partially or completely immune to it already. So accordingly we're talking about the herd immunity, which protects people from acquiring the flu and having a worse course of it. Also, when we're talking about the flu, we're talking about flu seasons, which tend to limit themselves. Whereas with COVID-19, we don't have a season. We just have the first wave of the pandemic, and we don't even know if it will continue spreading or not, like it will, but we will not know when it will end, and if it will be seasonal or not. Plus, a lot of steps were taken to flatten the curve and to slow down the spread of the virus, and I think it also played a role. And that's why the numbers are comparable. And that's exactly my point. I don't want anybody to think that it's just like a flu. It's a much more serious problem, and it has to be taken very seriously. And now we can talk about two other myths or misconceptions about this virus, specifically about its mortality rate. And these two myths or misconceptions are the complete opposites of each other. One group of people believes that the mortality rates are inflated, they are overestimated, and the real mortality rate is close to regular flu, which is like 0.1%, whereas another group of people is considering that the mortality rates are very, very high, and they are up to 10% in certain populations, and they're around 3.4 to 5 or even 6% worldwide. I believe that both estimates are wrong. One of them is minimizing the problem to the point that it's unacceptable. Another one is grossly overestimating the mortality rate and is effectively some sort of a fear-mongering factor. So I believe that the actual mortality rate is somewhere close to 1%, and I would like to try to explain why I think this way. So let's take a closer look at this statistic. CFR, case fatality rate. It's a standard epidemiological measure, which is effectively a ratio between the number of cases of people dying from this condition divided by the number of cases who have this condition. And unfortunately, both of these numbers, both the numerator and the denominator of this ratio, are very, very biased. Let's talk about the numerator first, the number of people who died from COVID-19. I think it's quite overestimated, and the reason for that is that in many cases it's very difficult to differentiate between the people dying from COVID-19 versus people dying with COVID-19. I'll give an example. COVID-19 is effectively a viral pneumonia, right? So if the people are developing viral pneumonia, their immune system goes down, they have a number of pathological processes happen in their lungs, and it's very likely they would acquire a bacterial pneumonia. Accordingly, if somebody comes to the hospital with bacterial pneumonia on top of the viral pneumonia due to COVID-19, it's almost impossible to tell which one was the cause of death. Also, we know that a number of public figures, the public health officials, like the White House task force, admitted that in many cases they are very liberal with establishing the cause of death, and if somebody dies with COVID-19, they would classify them as somebody dying from COVID-19. So the real number is likely lower, maybe even much lower than the one that is being reported. Now let's talk about the denominator, which is the total number of people who have this condition. We don't know this number. Quite honestly, I must say that we do not know this number. We've got a certain number of reported cases, but we know for sure that we do not test everybody. We do not have enough testing kits. We had some studies showing that when you start randomly testing people, it turns out that a lot of people, much more people actually have this virus and they don't have any symptoms at all. To give you a couple of examples, there was mass testing in Iceland and they have shown that at least 50% of people who have this virus don't have any symptoms and they would not normally be tested in the healthcare system. There was also a study done in the United States by Dr. Ioannidis and his team. At least he reported this study. I will review it in one of my future videos, but right now I would like to say that according to this study, there are a lot of asymptomatic cases in the United States. I'm not sure if it's like fully generalizable to the general population, even of the United States, let alone the world. But we know from at least 2 studies, independent studies, that the number of infected people is likely much higher than the number reported. Actually, let me add something about Iceland. A couple of weeks ago I was reviewing the statistics and I realized that their per capita rate of infection with coronavirus in Iceland was much higher than in the rest of the world. Just again to compare Iceland with the United States, in Iceland it was 4 times higher than in the United States. What does it mean? How would you take this number? Do you really think that in Iceland there are much more people who have coronavirus? No, I think that Iceland has done a really good job with testing people for coronavirus, whereas US is kind of lagging behind, and because of that, for each case of detected coronavirus infection, we actually have several cases of undetected. And it translates perfectly into the case fatality rates. If we compare the case fatality rates in these countries, we will see that in Iceland the case fatality rate is approximately 0.6%, whereas in the United States is 5.7% as of April 21st, 2020. So what does it mean? Do you really believe that people are dying from coronavirus in the United States 10 times more frequently than in Iceland? No, it's a purely statistical phenomenon. We've got an overestimation of the numerator and a gross underestimation of the denominator. And accordingly, the case fatality rate is like 10 times higher than in Iceland. I know it's still quite a scary number, but let me reassure you. Let me tell you that from everything I know about medicine and everything I know about epidemiology and statistics, this number is grossly overestimated. What will happen is in the next several months, as the United States, Canada, all the countries will ramp up their testing, we'll have more and more cases which are asymptomatic. The number of detected cases will go up. Accordingly, the case fatality rate will go significantly down. And again, I don't think it will ever reach the point when it's comparable to the case fatality rate for regular flu, which is 0.1%. I think it will be somewhere close to 1%. It's actually hard to tell, but it's not as scary, as high as it's being reported right now. And also a silver lining to that is that since we've got likely much more people who are carriers of coronavirus or who had already developed some sort of an immune response to this virus, likely we are much closer to the herd immunity than we thought. Again, I'm very curious about this study that Dr. Ioannidis has done, and I will definitely look into this, and maybe I'll even make a special video about that, because from what I've heard, I think there might be some very serious selection bias and reporting bias with this study. But again, I don't want to dig too deep into this issue right now. It's just one study. There are multiple studies showing similar results. So overall, the main point is that the fatality rate from this virus is still likely much higher than the regular flu, and at the same time it's not as high as it's been shown based on the data that we have today. Having said that, it's time to wrap up this video. I think we have dispelled 3 myths today, and I will keep working on this kind of educational video series on COVID-19. I will repeat myself and I will say that I believe that the problem is very serious, but I don't want anybody to panic. I don't want any kind of fear-mongering and sensationalism happening around this virus. I think it's a very bad thing to do, and at the same time I don't want anybody to not take it seriously. There are quite a few things that we can do to address this issue, both on collective, organizational level and on individual level. I already spoke about it in my previous video, but I will repeat these things because I think they are important. We can limit our contacts, physical distancing. We can use personal protective equipment. We can use sanitary measures like washing our hands, sanitizing different surfaces in our places and offices to slow down the spread of this disease. And it will buy us some time to think about better steps we can take to battle or fight this virus off. Speaking of these other things, I've got a couple of ideas, but I haven't formulated them properly yet. I will definitely make a video or two on those. So if you don't want to miss a thing, subscribe to my YouTube channel. In general, hit the like button, hit the subscription button if you, of course, want to receive notifications and if you like my videos. If you dislike my videos, it's fine. You are free to make comments, criticize whatever I say. I'm happy to, not to argue with people, but to address any of your concerns. And of course, as always, I'm open to any kind of interactions, leave suggestions, make comments. You're always welcome. Also, I have a website, drsamshealth.com. Please check it out. I've got all this information presented there in a written format with proper links and references. You can check it out and read it. So there are multiple avenues to communicate with me, and maybe, if you will, you can support me by subscribing to my YouTube channel and making my work a little bit more interactive. So that's it for today. Thank you for watching. Stay safe, stay strong, stay healthy, and I'll see you in my next video. All the best.